feel like the mainstream birth system is gaslighting mothers, forcing them to have interventions that they don't need. Let's discuss one of the crunchy mama favourites. Should you decline vaginal examinations when you're in labour? Firstly, I want to be clear, I always support patient choice, and if you want to decline anything in labour, that is absolutely fine by me. I just want you to understand why. So as a practicing NHS doctor who works on labour ward regularly and helps in both low risk and high risk births, let me explain more about why I think the cervical checks are a good thing to accept if they're offered to you. So these cervical checks are those vaginal examinations which tell us how dilated you are. They don't speed up labour, but we do recommend them regularly when you're in labour at the right opportunity because they give valuable information that genuinely changes the recommendations we give you for your care. We're interested to do these checks because we want to know your cervical dilation, how open the cervix is, the effacement, so how thin the cervix is, how low the baby's head is, and the position of the baby's head. Why? Well, contrary to what you might see on TikTok, it's not about us wanting to intervene more. It's not about us standing at the door with a pair of forceps, desperate to get in there. We want you to have that low risk birth that you want. Doing these examinations allows us to give you more information. For example, if you want some pain relief, you want to have an epidural, but we need to know how dilated you are before we do that procedure, just in case baby's head is about to come out. We also might want to know how dilated you are if you're feeling an urge to push, but actually it's too early, because if you push too early on a cervix that's not dilated, it can cause the cervix to swell and obstruct labour. And it allows us to offer you things like syntocinon, which is a drip that gives you more contractions, because if your cervix is opening very slowly or it's not opening at all, we can give this drip, give you more contractions, and potentially avoid you from needing an assisted vaginal birth or a cesarean section because your contractions increase and you're able to deliver your baby without needing any help from us. So it's actually not about increasing intervention rates. If we don't do the cervical checks at a crunch point in labour, we can potentially miss a prolonged labour, which raises the risk of infection and postpartum hemorrhage, because maybe you're 3 centimetres dilated, 3 centimetres, 4 centimetres, and it's been 12 or 15 hours. Yes, some people might just want to wait and wait because the baby will come when they're ready. But if you're not having enough contractions, labour's not moving forward, then you may bleed very heavily when baby does eventually come, or you might develop an infection which can affect you and the baby. Also, some people do dilate much faster than expected, so we might need to know that you're in the right place where you want to have the birth at the right time. So we usually recommend 4 hourly checks when you're in active labour, or we do these checks any time that your baby might be in distress so we can understand more about what's going on. Consent still matters every time. So if you're offered a vaginal examination, you can ask, what are you looking for? How could it change the plan? If you want to have fewer checks, then we would recommend just focusing on the ones at an important point in labour where a decision might need to be made. So when you were in labour, how did you feel about those cervical checks?